Welcome to Grace Optimal Wellness. What's your number? That's what we're talking about today. We're talking specifically about the medical symptom questionnaire number. So, I'm Andrea Weddle Knight, nurse practitioner since 2000, and have opened Grace Optimal Wellness in September of 2023. I am a wife, mother of 6 children, and business owner. And so I want to tell you how bioidentical hormone replacement therapy, gut health, and integrative medicine has changed my life personally, but I want to be able to share it with you in how my patients are improving and seeing dramatic changes in their own lives. So let's talk about some symptoms. Do you have this? You have brain fog. You walk into a room and you don't know why you walked into the room, or you make post-it notes all the time and you lose your post-it notes, or you just have trouble losing that belly fat. No matter what you do, you may go to the gym 5 times a week and you may feel like you really eat pretty healthy, but nothing will budge the scale. Maybe you have anxiety or depression that started suddenly. It's not like there's a depressive situation. It's just, why do I have all these symptoms? Or maybe you have decreased sex drive, or you're waking up between 2 and 3 o'clock in the morning for no reason at all. You may consider yourself a procrastinator or say that you lack motivation, or maybe it's chronic fatigue. You may have some food intolerances or gas and bloating, inflammation, achy joints, acne, skin rashes, or psoriasis. So a medical symptom questionnaire is a standardized self-reported questionnaire that we use in functional medicine to identify symptoms that may indicate the underlying cause of an illness. And so what this boils down to is it's a bubble sheet that we have you fill out before each appointment so that we can see your progression through your program. So with integrative health, we are looking for the root cause of things. So when you go to traditional medicine, you are kind of getting a band-aid put on what symptoms you're having. So if you go in and say that you're having insomnia, well, you may very well end up with a sleeping pill. Or if you say you can't lose weight, you may very well end up with a weight loss pill or an injection. But when you come to integrative or functional medicine, we're looking for the root cause. Why can't you sleep? Why do you not lose the weight? So we're not putting a band-aid on it. We're trying to find the root cause of it so that we can get you to feel like a better you. So I want to tell you about a few of my patients. These are real patients, and these are screenshots out of charts. There's no names or anything on them, but I want you to see how my patients are responding to the programs that we have them in. So first is Miss G. She's a 42-year-old female. She's a wife, mother of 2 active teens. She works a full-time job. When she came in, she was having trouble sleeping. She was having severe brain fog, anxiety, and severe joint pain. So just 7 weeks into her program, after her new patient consultation, we're really not getting started yet, or just barely getting started into all that we have to offer. Her MSQ, this is that score that she gets when she first started, was 104. So anything over 80 is significant, and over 100 is considered severe. And so she was 104, and in just 7 weeks, she dropped her symptom or her MSQ to 37, and we're just getting started with her. So this next patient is Mr. M. He's a 54-year-old male that came in initially because he was chronically fatigued and lacked motivation and had just lost his mojo. We corrected his gut issues. We used some testosterone pellets, and now he feels like he has his life back. He has more energy, he has an increased sex drive, and he has lost weight. So you can see that his MSQ score was 87, and it went up to 95 initially, and then it decreased down to 45. So he recently, after starting to feel better, he had a rib fracture and he blamed it on feeling like he was in his 20s again. He had so much energy and said, I just did something stupid. So next is Miss P. She is a 56-year-old female. She was referred to us by her psychiatrist for uncontrolled anxiety. She had not driven by herself in years, and through using some hormones and supplements, we were able to decrease her anxiety and eliminate some of her medications. And she actually drove to her last program visit by herself. She was ecstatic because she hadn't been able to do that for years. So then this is Miss S. She is a 48-year-old female that came into the office as a last-ditch option. She really was reluctant to spend money on this type of investment. She had severe gut issues. She had trouble losing weight and decreased sex drive, and it was affecting her marriage. After 3 months, her MSQ went from 173. That's the highest I've ever seen it. And when I've talked to other providers, they've never had anybody with that high of an MSQ. And it has dropped down to 41. That's in 3 months. Her husband is ecstatic about her new sex drive, and she feels like herself again. Next, we have Miss W. She's a 32-year-old female. She was miserable, struggled with sleep, had terrible GI symptoms, and trouble losing weight. In 7 months, she lost about 20 pounds, and her symptoms went from an MSQ of 74 to an MSQ of 0. Completely resolved through nutrition and correcting her gut imbalances. There were no hormones needed for this patient. So I want to show you, these are just the MSQ sheets on several of our patients. I have to admit, when we first started this computer system, we were not proficient in how to utilize some of this. And so we didn't get to see the benefit on the patients initially when we opened the business. But I want you to see how, they're progressing over time. Everybody is declining. Everybody is having significant improvement in their symptoms. So if this is something an approach that you feel would be appropriate for you, I would like for you to go to our website. You can actually fill out an MSQ form and get your own score so you know where you are. And then if it's something that you would like to look at further and have a consultation, there's an intake form on our website. You can fill that out and then my staff will contact you and we can get you to feel like a better you.